Hey guys, this is Medicosis Perfectionalis, where medicine makes perfect sense. We continue our playlist called Pulmonology. In the previous video, we have talked about the flow volume loop, which is part of spirometry. Today, we'll talk about ventilation, hypoventilation, and hyperventilation. First, let me help you by answering the previous case. Which of the following graphs represent a patient with a phrenic nerve injury? And here are your choices. They correspond with the colors. So A is the blue, B is the black, C is the indigo, D, etc. Now pause, and here the answer is going to be C, because a phrenic nerve injury will lead to diaphragmatic paralysis. This is an extrinsic restrictive lung disease. If you see here, the difference between the blue and the indigo is only in the volume. On average, if you have a lung fibrosis, you will have a lower volume than if you had an extrinsic problem, like problem with the thorax, with the diaphragm, etc. Because man, pulmonary fibrosis is horrible. It's over. Let's talk about ventilation. The story of the oxygen. You breathe in air which has oxygen. It goes to the lung, then to the arterial blood, and this is gas exchange thanks to type 1 pneumocytes. Then on the hemoglobin. Then the oxygen goes to the tissue, and then CO2 comes out of the tissue as a waste product. Then jumps on the hemoglobin. Venous blood, back to the lungs, CO2, you breathe it out. Now I have premium videos on Patreon. These videos are not available on YouTube. Please go to patreon.com/medicosis and click on premium videos here on the left side, and then you can watch them. Now let's call them name. The percentage of oxygen in the atmosphere is called FiO2. Then in the lung, oxygen is called PaO2. A stands for alveolar. Then in the arterial blood, it's called Pao2, which stands for arterial. On the hemoglobin, it's called SaO2, which stands for hemoglobin saturation. And then in the tissue, and then carbon dioxide. Carbon dioxide, the hemoglobin is the carbaminohemoglobin. And the vein is called PvO2. We're talking about oxygen. We're talking about carbon dioxide, is going to be PvCO2. So what's the difference between ventilation and perfusion? Here is your alveolus, and here is your pulmonary artery. To get the oxygen in and to get the CO2 out, this is the oxygen, or this is the gas exchange or diffusion. So ventilation is to get the oxygen to the alveolus, perfusion is to get blood into the pulmonary artery, and then diffusion is the gas diffusion in between. Hyperventilation is when you do like this. This decreases the PCO2. And when I say hyperventilation, I mean hyperpulmonary ventilation, not the alveolar one. You're washing out CO2, we get it. CO2 is an acid. When you lose an acid, it's a state of alkalosis, called respiratory alkalosis, because it's the lungs' fault. This can lead to decreased ionized calcium, leading to tetany, and it can also lead to decreased serum potassium, hypokalemia, muscle problems, and problems on the EKG. There are several problems caused by hypokalemia, including the famous U wave. So here is P, Q, R, S complex, and then the T wave, and sometimes there is the U wave. This is caused by hypokalemia. And you will have increased PaO2, P big AO2. This is not the small one. I made a mistake. So, whenever the CO2 in the alveoli decreases, the P big AO2 in the alveoli increases. CO2 and oxygen hate each other. Let's talk about hypoventilation. You retain the PaCO2. You increase the PaCO2 in the blood. This is a respiratory acidosis because CO2 is considered an acid because it gives carbonic acid thanks to the enzyme carbonic anhydrase. Decreases PaO2. Again, oxygen and CO2 are opposite. If you increase P big A CO2, you will decrease P big A oxygen. This will lead to decreased P small a oxygen in the blood. This is called hypoxemia. When you have low P small AO2, it's hypoxemia, which is a cause of hypoxia. You will have decreased oxygen saturation, of course. And you'll probably end up with cyanosis, bluish discoloration of skin and mucous membrane. Just because your respiratory rate is increased doesn't necessarily mean that the alveolar ventilation increased, because you could be just ventilating the dead space, like an idiot. I'm sorry. How come I'll tell you how come. Because pulmonary ventilation is the respiratory rate, which is around, let's say, 12 per minute, times the tidal volume, which is around 500. Alveolar ventilation is the respiratory rate, which is about 12, times tidal volume, which is 500, minus dead space volume, which is around 150. Of course, this is going to be lower than the pulmonary ventilation. Alveolar ventilation is the only thing that matters. So, with shallow, rapid breathing, like an idiot, what are you doing with your life? You're decreasing your alveolar ventilation. Even though the respiratory rate is increased, the dead spaces increase even more, making the alveolar ventilation so poor. But if you are a wise person, deep, slow breathing, this increases your alveolar ventilation. How come? I think the respiratory rate is going to be low. Yes, but the dead space is going to be so low you won't even notice. And the tidal volume is going to be huge. Now, causes of hypoventilation and hyperventilation. First, what is hypoventilation on the ABG? You retain PaCO2. Therefore, you increase PaCO2 in the blood. This is respiratory acidosis. And you decrease PaO2. Therefore, you decrease small aO2, which will lead to hypoxemia and hypoxia. Hyperventilation is the opposite. You decrease PCO2, leading to respiratory alkalosis because you're washing out the CO2. If the big A CO2 is low, you have increased P big A O2. This is a mistake. It's increased P big A O2. Alright, causes. It could be like a multitude of things. First, the problem could be in the respiratory center. Hypoventilation, trauma to your brainstem disease. Most drugs, barbiturate, narcotics, but there is a great exception. There is a drug that will lead to hyperventilation, and this is going to be acetyl salicylic acid, also known as aspirin. Aspirin will lead to hyperventilation. What are the respiratory center problems that can lead to hyperventilation? Okay, overstimulation, such as salicylate. Pregnancy. In pregnancy, you increase alveolar ventilation, which matters, without increasing the respiratory rate. This increase in PaO2 is actually good for the fetus because he or she needs oxygen. And in pregnancy, if you take the PaO2, like ABG from mommy, it's going to be more than 100, which is super normal, and this is good for the baby. High altitude, for the same freaking reason, it stimulates your respiratory center to hyperventilate because in high altitude there is less pressure. Therefore, there is less partial pressure of oxygen. For dummies, it's like thinner oxygen, it's less oxygen up there. Okay, when you go up there, there is less pressure and less oxygen. Okay, we got it. When there is less oxygen, your brainstem is going to respond by increasing ventilation. Septic shock. In septic shock, the patient is hot, so the skin is warm, and there is hyperventilation. This is opposite to hypovolemic shock. The patient is cold and clammy. Everything is smooth and cold. Stress. Of course, when you have stress or a panic attack, you're hyperventilating. The problem could be in the upper airway. Do you have an upper airway problem that can lead to hypoventilation? Of course, acute epiglottitis, which is an emergency. Croup. Obstructive sleep apnea. Obesity. Chest wall problem. Kyphosis, scoliosis, kyphoscoliosis, ankylosing spondylitis, flail chest, multiple rib fractures, paradoxical breathing, and this is fatal. If you want to see an F mnemonic about flail chest, please watch my first video in this playlist on pulmonology, and it was called Clinically Oriented Anatomy of the Thorax. Rib fractures, on the other hand, will lead to hyperventilation due to the pain. So be careful. Rib fractures could be hyper. If it's flail, it could be hypo. So rib fracture is kind of in the middle. Muscles. Amyotrophic lateral sclerosis is going to lead to hypo. All of this is going to lead to hypo. Guillain-Barré syndrome, phrenic nerve injury, polio, which is a lower motor neuron lesion. Some people call it post-polio syndrome. Myasthenia gravis, hypokalemia, hypophosphatemia. Why? Because we need phosphate for ATP. Why does hypokalemia lead to hypoventilation? Because hypokalemia decreases muscle contraction, and we will talk about this in acid-base disturbance. Check my playlist called Fluid, Electrolytes, and Acid-Base Disturbance. Okay, hypo versus hyper. The problem could be in the lung. Okay, such as what? In hypo, obstructive disease, chronic bronchitis, we call them blue bloaters because they breathe very slowly. And there's wheezing. Severe asthma, cystic fibrosis, all of these are obstructive. Severe pulmonary edema, ARDS, and neonatal RDS. On the other hand, cause of hyper-restrictive lung disease because the lung is restricted from filling. There is less air coming in. To compensate, you will hyperventilate, and thanks to your great brainstem. Pulmonary embolism will lead to hyperventilation, very important. Early phase of asthma, early phase of adult respiratory distress syndrome, early phase of pulmonary edema, chronic illness such as a patient in a hospital will have respiratory alkalosis thanks to hyperventilation, and this is extremely common. Pneumothorax, tension or spontaneous, because in either one you will get sudden shortness of breath and sudden pleuritic chest pain. Mechanical ventilator, of course, can lead to hyperventilation. We are forcing oxygen into your system against your will. Clinically, in hypoventilation, you will have respiratory acidosis. Whenever you have an acidosis, you will have somnolence, stupor, etc. Why? I'll tell you why. Because metabolism produces acid. And you already have acidosis. Do you want to increase your metabolism and increase the acid? No. So your body reacts by reducing metabolism, by reducing your movement. Don't just be crazy. Just calm down, man. Calm down. Calm down. Because when you calm down, there's less metabolism. There are less acids produced, and it's gonna mitigate and alleviate the problem. Cerebral edema. Why? Due to vasodilation of cerebral vessels. Because when you have hypoventilation, you probably have hypoxia. When you have hypoxia, every single organ will vasodilate, including your brain, except the lung. The lung vasoconstricts in response to hypoxia. But we're talking about the brain. The brain will vasodilate. When you vasodilate, you increase the probability of fluid rushing out, increased hydrostatic pressure, because you're bringing more blood into the vessel. Cyanosis. Why? I've told you have hypoxia due to hypoxemia. Okay, how to diagnose hypoventilation or respiratory acidosis? Clinical, and use the ABG. Treatment, treat the underlying freaking cause. How about hyperventilation? Clinically, you have respiratory alkalosis because you're washing out CO2 out, leading to lightheadedness and confusion. Low calcium level leading to tetany, low potassium level leading to muscle problems. Diagnosis, clinically and ABG, treat the underlying flipping cause. Okay guys, people who smoke, why would you do this with your life? Okay, human psychology is weird. Cigarette smoking will lead to chronic emphysema. Chronic emphysema will lead to hypoventilation, leading to two things. Decrease the PO2, hypoxia, and you increase the PCO2, hypercapnia. Together they lead to a state of air hunger. You are hungry for oxygen. And give it time, give it like a lot of time, it ends up in death. That's why a very common question on your exam with a patient with COPD, what reduces mortality in cases of COPD? Thank you for watching. Please subscribe and join the tribe. Hit the bell to get notified. Follow me on Facebook. I have 100 cases there. You can support this channel on Patreon. You'll get my premium videos. You'll get my cases. You'll get my audio notes, my PDF notes, everything organized in amazing Dropbox folders. And these are available for you to download and keep for you forever. Thank you so much for watching. As always, be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.